Anyone who isn't satisfied with their current erectile dysfunction treatment is potentially a good candidate for a penile implant. The penile implant is covered by Medicare and is usually covered by most commercial insurances. There are two types of penile implants in the United States: the malleable penile implant and the three-piece or inflatable penile implant. A malleable implant is always erect and can be positioned either up and down, similar to the function of a gooseneck lamp. An inflatable implant is used to mimic the normal penile physiology, where there's an inflated erect state and then a normal flaccid state. Because the malleable implant has fewer moving parts, it can be somewhat more durable, but generally patient satisfaction is higher with the inflatable implant. During surgery, the dimensions of the penis are measured both backwards into the body and out towards the end of the penis. And each implant is tailor-made to the exact correct size for the patient, at the biggest size that we can get in. The inflatable penile implant has a pump that is placed in the scrotum at an area that's easy for you to feel, but entirely concealed within the body. When you want to have sex, you pump the pump until you get a good rigid erection that lasts as long as you want. Whenever you're done having sex, you press the deactivation button on the pump and squeeze the penis. We don't disrupt the nerves and the sensation of the penis at all. If you orgasm before surgery, you will orgasm after surgery. If you have an ejaculation before surgery, you will have an ejaculation after surgery. There should be no change to the sensation of sex. The implant is placed entirely inside the body, either through a small cut on the scrotum or a small cut just above the penis. No part of the implant should ever be exposed to the outside world. The implant is made of a medical-grade plastic called BioFlex that is entirely medically safe for implantation. Inside the implant is a normal saline solution, just normal salt water. The penile implant is placed through a small opening in the scrotum or just above the penis, depending on the approach. The cylinders are placed inside the penis, a pump is placed inside the scrotum, and a reservoir that holds the fluid is placed up in the abdominal region through the same opening. Typically, people either go home the same day or spend at most one night in the hospital. Recovery afterwards is about 1 to 2 weeks of discomfort and pain while you're healing. And then we can begin cycling the device, and most people are having sex between 4 and 6 weeks after surgery. The inflatable penile implant usually lasts between 10 and 15 years after emplacement. Patient satisfaction rates with the penile implant are extremely high, around 90%, because it restores spontaneity to the relationship. Whenever you want to have sex, you simply inflate the device and you can have sex. Generally, people are very happy with their outcomes. After penile implant surgery, your penis will be the same size as it was before penile implant surgery. If you grab your penis and stretch straight out from your body, your stretched penile length, that's the length you can expect after surgery. It does not make your penis any bigger, and it does not make your penis any smaller. The main risk of a penile implant is the risk of infection. About 1 in 100 patients will get an infection after surgery that will require an additional surgery to wash out the infection and replace the inflatable implant with a malleable implant. These risks are slightly higher in diabetic patients, although very similar if the diabetes is well controlled. Other potential risks are poor placement of the pump or occasionally a mechanical malfunction after implantation of the device.